This is Kawempe. Kawempe is a region in the city of Kampala, Uganda's capital. It is synonymous with the life of an informal settlement, just like elsewhere in East Africa, and connected to rapid urban growth and poverty. Many stories are told of the people here and how they live, but the innovative business approach for improved sanitation set it apart.
The life was terrible. The situation was bad. Most of the community members, we had no toilets at all. Being on a swampy area, toilets in this area is very hard to be constructed. So it was very hard for the community to have a standard toilet. And what people used to do, they used to do open defecations.
In 2010 alone, latrine coverage of about 36%. And most of these were actually makeshift structures that people would actually open during the rainy seasons, and they would flood in the neighboring communities. And this meant that the waterborne diseases like typhoid, diarrhea were very, very rampant in Kawempe.
The former Secretary General of the United Nations, Kofi Annan, once said that there is no invention in the world that has done more to save lives and improve health than the sanitation revolution triggered by the invention of the toilet.
In 2013, CD received a grant worth 1 million euros from the African Water Facility through ADB to implement the KUPSIP project in Kawempe.
Kawempe Urban Poor Sanitation Improvement KUPSIP project aims to contribute to improved sanitation, latrine coverage, environmental health, livelihoods, and reduced under-5 child mortality. This project is designed to offer municipal-supported sanitation and improvements, strengthen the capacity of service providers, and promote the active participation of the community and private sector.
The support of the African Development Bank enabled us to acquire 3 Faecal Sludge trucks, and these ones are going to be very handy as far as operating that mini Faecal Sludge treatment in Kawoja is concerned.
I thank ADB to fund us with money to come up with this truck, because it has helped us a lot.
In schools alone, we're able to reach about 2,500 pupils with the facilities that we put up, but also the software, the trainings on sanitation, the sanitation tools that we provided, and the like. For the communities, about 2,600 people were benefited from the project through the toilets that we put up, also the emptying services, because we were able to procure cesspool trucks with this funding from AWF. We were able to train so many communities about sanitation improvement, provide sanitation promotion tools like spades, gloves, wheelbarrows. We were able to conduct sanitation competitions in the informal slum communities of Kawempe. Even schools would conduct annual sanitation competitions during the sanitation week to edutain both the pupils but also the communities about sanitation.
The interventions has enabled improved health and welfare of over 200,000 residents in Kawempe and 25 schools, where student sanitation clubs and school sanitation management committees were established and trained on hand washing with soap, menstrual hygiene management, personal hygiene, and sustainable clean environment. Reduction of pupils stance ratio is now at 56:1, down from 70:1 across the beneficiary schools. Elsewhere, back at the informal settlement, there has been elaborate sustainability of the sanitation projects started by Community Integrated Development Initiative, CD, by advancing training for local masons to develop pro-poor modular toilets. 76 local masons have been trained and hand tools distributed to local masons, creating critical linkage to job creation.
With the introduction of this project, it has improved the area greatly. It has contributed employment. As you see, there are a number of users who are employed on this project.
I think this project provides a case that it can all be possible to have improvement in people's welfare in terms of hygiene and sanitation if an appropriate approach is adopted.
At the end, the project made tremendous contribution, reducing the 3 key water and sanitation diseases of cholera, typhoid and diarrhea across the target population. Improved hand washing at household level and latrine use was registered. Likewise, there has been a reduction on the number of people undertaking open defecation. Number of people with access to sanitation, especially latrines, has gone up.